Tocilizumab is a medicine used to treat conditions like rheumatoid arthritis. Which interleukin does it specifically block? Right answer is option B, interleukin 6. It's a monoclonal antibody that blocks the interleukin 6 receptor, reducing inflammation. It is commonly used to treat rheumatoid arthritis and some other inflammatory conditions. A 20-year-old man has been suffering from lower back pain and early morning stiffness for the past 2 years. He also has pain in both heels for the last 6 months. What is the most likely diagnosis? Right answer is option C, ankylosing spondylitis. Ankylosing spondylitis commonly affects young adults and causes chronic inflammatory back pain with morning stiffness. Heel pain due to inflammation where tendons attached to bone is another classic feature. A patient is brought to the hospital after a road traffic accident with severe pain around the left hip. On examination, the affected leg is flexed, adducted, internally rotated, and appears shorter than the other leg. What is the most likely diagnosis? The right answer is option D, posterior hip dislocation. A posterior hip dislocation is the most common type after a road traffic accident. The classical position is flexion, adduction, internal rotation and shortening of the affected limb. During a psychotherapy session, a therapist develops both conscious and unconscious emotional feelings toward the patient. What is the phenomenon called? Right answer is option B, countertransference. Countertransference is when the therapist's own emotions and past experiences influences their feelings towards a patient. Recognizing it helps maintain professional and effective therapy. A patient stopped drinking alcohol 3 days ago. He now has irritability, confusion, agitation, paranoid thoughts, visual hallucinations, and altered consciousness. What is the most likely diagnosis? The right answer is option A, delirium tremens. Delirium tremens usually develops 48 to 72 hours after stopping alcohol. It is a medical emergency characterized by confusion, agitation, hallucinations, and altered sensorium requiring urgent treatment. A 30-year-old man weighs 70 kg and his serum sodium level is 120 milliequivalent per liter. What is his estimated sodium deficit? Here the right answer is option B, 840 milliequivalent per liter. Sodium deficit is calculated as 0.6 into body weight in kilogram into 140 minus current sodium. So 0.6 into body weight of this man is 70 into 140 minus the serum sodium level of this man is 120 is equal to 1.6 into 70 into 20 is equal to 840 milliequivalent. A body fluid sample shows the following electrolyte levels: sodium 10 milliequivalent per liter, potassium 140 milliequivalent per liter, chloride 4 milliequivalent per liter. From which body compartment was this sample most likely taken? The right answer is option D, intracellular fluid. Intracellular fluid contains high potassium and low sodium and chloride. These electrolyte values match the composition of fluid inside the body cells. A 37-year-old woman has been having headaches for the past 6 months. She has been taking painkillers regularly for relief. Recently, her headache became worse for a few days, but it improved after she stopped taking the painkillers. What is the most likely diagnosis? The right answer is option C, medication overuse headache. Using painkillers too frequently can actually cause or worsen headaches. These headaches usually improve after stopping the overused medication, making medication overuse headache the most likely diagnosis. A 20-year-old woman with mitral stenosis comes to the hospital with breathlessness and chest pain. Her pulse is irregular, suggesting atrial fibrillation. An echocardiogram shows no blood clot inside the heart. Which medicine is the best choice to prevent future blood clots? The right answer is option B, oral warfarin. Patients with mitral stenosis and atrial fibrillation have a high risk of stroke. Warfarin is a recommended anticoagulant for preventing blood clots. A patient with kidney failure comes to the hospital with very low urine output, swelling of the feet, headache and a blood pressure of 160/90 mmHg. Which antihypertensive medicine is the best choice? The correct answer is option A, amlodipine. Amlodipine, a calcium channel blocker, is effective and safe for controlling high blood pressure in patients with renal insufficiency.